Welcome to our Spark session. We're excited to talk to you today about innovative approaches that we used and work with the State Health Department in Kansas to engage more community members and broader representation from communities than traditional needs assessments are able to do. We're really good at traditional approaches in our work. We use epidemiological data, trend data, surveys, focus groups, and these are really important to the overall needs assessment and have certainly been included in the Kansas Maternal and Child Health Needs Assessment. But what we found is that these traditional methods typically don't engage the diversity of people in the communities across the state that we want to engage. So we've tried some new and different things. We've used different technology and approaches to try to increase our reach and broaden the scope of the needs assessment, and we're excited to share those with you today.
In the fall of 2019 and early 2020, our center assisted the State Health Department in coordinating the development of the 5-year Maternal and Child Health Needs Assessment. Our approach entailed using many of the traditional methods that Rebecca already mentioned, but we also included 4 methods that we designed specifically to try to reach traditionally unheard voices. These included electronic kiosks, Our Tomorrow's Stories, a photo project involving Kansas teens, and regional interactive open houses.
So the first innovative data collection method we used involved kiosks. Kiosks are small stands with a series of smiley face buttons that have traditionally been used to collect customer satisfaction data. So you've likely seen kiosks in places like airport bathrooms or after checking out at IKEA or other businesses. The kiosks are designed to make it very easy, literally using one touch of a button, to capture quick feedback from anyone. So we applied this concept to the MCH needs assessment. We used 18 kiosks across the state in various settings, like health departments, medical practices, educational settings, and in libraries. We generated several questions based on each of the MCH domains, and the questions were rotated every few days to generate as much feedback as possible in a short amount of time. In some cases, we were also able to ask a follow-up question about why certain answers were chosen, and then based on a positive or negative response, respondents could identify the primary reason for their response, which really gave us a greater insight into factors at play and why we were seeing answers that we saw. Respondents could also include open-ended text feedback to provide additional details. This was particularly helpful in highlighting regional strengths and differences that we saw across the state. Using the kiosks allowed us to receive rapid feedback about experiences and perceptions of maternal and child health issues. We had over 3,000 responses to kiosk questions in about 5 months, which was even cut short by COVID-19, and really gave us insight into experiences of people that we otherwise wouldn't be able to gather from traditional data collection methods. The kiosks also have a touchless option where a QR code or a URL link can be accessed via personal device to answer the question on the kiosk. So there is also the capacity to answer a kiosk question without actually touching the kiosk.
So another approach that we used is a tool and an approach that we call Our Tomorrows. And Our Tomorrows is a story collection process that allows the storyteller to code their own story rather than the researcher doing thematic analyses. The storyteller actually answers a series of questions in the form of triads and dyads and canvases to help understand what are the patterns, what are the emerging trends coming from not just individual stories, but the collective of stories. In 2019, we collected over 2,000 stories from people in the state of Kansas. All 105 counties across the state were represented as part of our preschool development grant needs assessment. And we were able to use that story bank to pull stories that addressed and talked about maternal and child health related issues. Of those 2,000 or so stories, over 200 of them were related to maternal and child health. We were able to take those stories and the patterns and responses that we received to understand the experiences of families across the state and how they interacted with the maternal and child health system. The prompt for story collection was really broad. It would ask respondents to share about a time when their family was thriving or just surviving. So the fact that over 10% of the stories we collected addressed specifically maternal and child health domains was in itself interesting and useful information to understand the prevalence of maternal and child health issues across the state. As we dug into that data, we were also able to look at the way people responded to their own needs. And as you can see in the responsibility triad here, every one of those dots is a story that was told, and the storyteller placed their dot on this triad around who was responsible for helping the children or the family to thrive. You can see the pattern here. It's very heavily weighted around family. And so as service providers connected to the government, this kind of information, as we dig into these stories, really help us think about how we might engage extended family, how we might message and make services available to better support the family as a whole, since what we've heard overwhelmingly here is that families play such an important part in the health of their members. The stories and the themes were taken to the State Maternal and Child Health Council, where they workshopped them. They actually dug into the stories and they looked at the patterns and used that conversation to help inform action steps as part of the needs assessment and their larger strategic plan moving forward.
Another really rewarding approach that we utilized was a youth photo documentation project. We worked with youth organizations across the state. Youth photographers were asked to capture images in their community of things that they thought impacted their health or the health of friends and family. We had 3 groups, 2 from rural Kansas towns of less than 3,000 people, and also 1 group from inner city Kansas City, Kansas. Some of the powerful takeaways were concerns about behavioral health, including the toxic effects of stress and substance abuse, recognition of the importance and challenge of getting adequate sleep, eating healthy, and being physically active, and the presence of an innate understanding among these young people that where people work, live, and play are key influencers of health. This was reflected in photos we received that focused on things like housing, education, and even on vibrancy of the community through the lens of art and culture. We also held 6 regional open houses across the state. Our events were held in public libraries to encourage walk-through traffic. Open houses were promoted locally through a variety of means, including flyers and advertising and social media. At each of these open houses, there was 6 stations, each with different types of engaging activities. The most popular station by far was a budgeting station where each participant was given $100 in the form of 10 $10 bills. They were asked to allocate these among 8 health issues. And what we heard were that mental health and behavioral health were real concerns. Kansans were also concerned about a lack of healthcare professionals, especially in rural areas. And lastly, many Kansans were worried about their pocketbooks. People were worried about the cost of healthcare, but also having enough money to meet their basic everyday needs. Using any method, achieving adequate representation of diverse voices is challenging. However, we felt these methods provided unique means to capture often unheard voices. The use of public spaces like libraries, clinics, and community centers provided an avenue for participation among diverse populations in communities across the state. Local partners like MCH programs, library staff, and others were invaluable resources helping promote and encourage participation. For example, in some communities, trained volunteer citizen journalists helped collect Our Tomorrow stories. And open houses were promoted by community partners through advertising, flyers, and social media posts and events. Hundreds, if not thousands, of Kansas residents had the opportunity to make their voices heard through these efforts.
So we had a lot of fun doing this needs assessment and trying out some of these new approaches. And what we found is that we still were able to accommodate input from the usual suspects, the public health nurses, the parent educators, the home visitors, the people working in the local health departments. But by using these approaches, we were able to engage a much broader range of the community. Our largest kiosk use was in the vital statistics office, where we had a number of responses in Spanish as well as English. We were able to engage youth in new and different ways, and able to pull in parents after story time, because balloons are a really great attractor. One of the most exciting things is certainly all of this helped to inform the 5-year statewide needs assessment, and provided not only information to help the state health department prioritize, but also some clues about actions and next steps in response to those needs. It's also really exciting that community partners have asked to use some of these methods in their work. Human Rights Commission in one of the communities has asked to use kiosks to gather community-wide perceptions on systemic racism. It will really help to inform their work in the community. The budgeting station, Play Money, is also a really great attractor. That budgeting exercise from the open houses was used by at least 2 Kansas counties as part of their COVID relief funding decision-making process. And Our Tomorrows continues across the state. To date, we have close to 5,000 stories across our a year and a half of doing this work. And that story collection was really timely with COVID response, because we were able to quickly understand needs of childcare providers and families, and help state decision makers have the information they needed to respond quickly to the needs of families and providers in the state. We're looking forward to continuing to explore these methods, and to find new and different approaches to engaging a wide range of community members in statewide needs assessment work. Thanks so much.
We'd very much like to thank the Maternal Health Learning and Innovation Center for providing us the opportunity to participate in this symposium and to share this information with all of you who are participating today. Thank you.